Hey guys, it's me, it's Dr. Masud, and I want to talk to you today about testosterone, anti-aging, and baldness. And I promised myself, it's really late, my eyes a little red, but I promised myself I was going to make this video for you guys today because I had a lot of patients come in with this question. They were concerned, they're on testosterone therapy about baldness. And so, what's great about, I guess, being a holistic physician as well as, a chiropractor and seeing all the stuff that I get to see is I get to see like the dynamics of all these other physicians, and I get to see what other doctors are doing with testosterone therapy and get to talk to them, discuss with them, and then I get to see really the ones that seem like they're really doing a great job with that, and then I get to research that to see which ones are actually doing a really good job with that. And so I want to address this a little bit with you. And a disclaimer, I'm not your physician, so I can't give you advice, but this is something, if I was doing that, this is what I'd be looking at, okay? And so, when you're talking about anti-aging, testosterone, baldness, and so forth, the first thing is that a lot of people, you see a lot of commercials out there today talking about low T and testosterone. In fact, it's everywhere. And in fact, I'm getting a lot of patients that are coming in asking about that, as well as actually getting treatment from their physicians with it. And a lot of the physicians don't even really know what they're doing, because I'm realizing that talking to other physicians, and boy, is there a big difference between doctors. But for you, so this is what I've kind of gathered into this, okay, is that the first thing is that a lot of times patients are coming in for testosterone. Why? Because they've got low energy. They may be gaining body fat, getting heavy. They are also having issues with libido or maybe even erectile dysfunction, but they're having a whole slew of other symptoms that they just can't explain. And so what happens is they go into these clinics, and basically the doctor does a physical, does a history, and then they do their labs or their blood work. And a lot of times if they see low T or low testosterone, what they'll do, the doctors, after everything has been cleared, and they'll do like an EKG, making sure the heart's all good, then they'll start them on some type of low dosage of testosterone to elevate the testosterone level back up. And hopefully they're hoping the person's going to start feeling better and so forth. And then they're going to repeatedly actually check like what's called their hematocrit, which they're actually looking at to see that their blood's not getting too thick. And so if their blood's actually getting too thick, then there's procedures that they'll actually do to thin it so they don't end up having some really serious heart problems and so forth. The other thing is that periodically they're actually doing lab work to see where those levels are now. So if they have to adjust it, decrease it, stop it altogether, or increase it, and so forth. But during that process, when they're doing lab work or blood work, one of the things that I'm seeing some physicians are hitting on and other physicians are not hitting on. And if you're concerned about being, bald, if you're on testosterone, there's a level in there that they should look at, which is called your DHT. And the reason that's so important for them to look at is because DHT, it has been actually associated with destroying the hair follicles and causing you to go bald. And where does the DHT come from actually? Well, DHT is also known as, dihydrotestosterone, and actually it's converted from testosterone by an enzyme called 5-alpha reductase. And so what that enzyme does, it takes part of that testosterone and it makes this DHT out of it. And then the DHT can, if it gets elevated too high, bam, you could start to have your hair falling out, you could be getting thinner, and a slew of other health problems. And so a lot of times people have no symptoms whatsoever, and they don't have, hair falling out and blah, 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 but their DHT levels are elevating. And if they keep elevating like that, pretty soon it's a little bit too late and they go bald. And so it's really important, really important when they are checking your labs, that they're looking at that DHT level to make sure it's up or down. Now, if it's elevated, again, I can't tell you what to do, but the most common thing that I'm seeing the most doctors and other supplements, but the most common one that doctors are using to lower that DHT level is an herb or supplement that you've probably heard of for your prostate called saw palmetto. Well, saw palmetto, turns out, is not just good for your prostate. It actually has been shown, and there's a ton of research behind that it's been shown to help lower your DHT levels. So therefore, by taking that, the right dosage based on what your lab works are, it could actually help or support or possibly even prevent you from going bald. So what's the moral of the story, guys? The moral of the story is this, is that, if you're going to do any of these types of therapies, number one, make sure you go to see a doctor. Number two, make sure the doctor is checking you regularly. They're checking your hematocrit, they're checking your labs, and they're doing all the right healthy functional things to make sure that you're staying in healthy ranges. And then if something's going up, make sure that they're doing proper procedures to bring certain things down and to keep you healthy and strong and vital. Because remember, if we're talking about the anti-aging game, we're talking about nobody can stop aging, but there's a way that we can also do things that can help us to age very gracefully. And so that's what we're talking about, being healthy, being strong, and being vital, and then just feeling good. And so, guys, that's what we want from you. We want you to be healthy. I want you to be strong. And there's a lot of natural things that I'm going to probably address in another video that you can do to increase your testosterone, from diets to nutrition to exercise. There's so many things that you can actually do to elevate your testosterone levels naturally as well too, guys. And so right now you've been listening to Dr. Masud. Guys, I hope you got a lot of value out of that in a short period of time. All right, guys, take care. Bye-bye.